As a new nursing agency, you're probably starting alone or with a few friends who have never ran a business. Naturally, the concern is all the administrative work and financial work involved with running a business like this, such as workers' comp, taxes, and of course, paying out of pocket for your payroll costs. Most founders turn to PEOs and back office providers, and in today's video, we're diving into this topic to determine if this is a good thing or a terrible idea. My name is Carl Pierre, and I've built an 8-figure healthcare staffing and home healthcare agency. I started to teach others how to do the same through my consulting company, Passive Workforce. This channel is meant to teach you how to start, grow, and sell your business just as I have, so that you can ultimately obtain the financial freedom that you're looking for. Please like and subscribe to our channel for more information just like this. To start, let's talk about what a PEO and back office actually is. By definition, a PEO is an HR and payroll outsourcing company meant to take on that burden for a fraction of the cost, as opposed to running those departments in-house. When you're just starting out, it's going to seem pretty daunting to have all these departments. When you look at an established business, they have folks in HRs, they have recruiters, they have compliance people, they have a payroll department, and when you're just getting started, you're not going to be able to afford all that, mainly because you're not making any money yet. So it's going to be quite discouraging, and it's going to make you think, how am I going to do all this by myself? And how could I possibly afford the team that I feel I'm going to need to get to the point that I want to be in? So this is why these PEOs and back offices exist, because they recognize that you don't have the resources or the skills to necessarily start and do everything on your own. And what they're doing is filling in those gaps. Some of the PEOs provide HR tools, sometimes they provide software, sometimes they provide you with financing for your payroll, or even the workers' comp policies. For those of you who are still in the early phases, when you're applying for workers' comp, there's a lot that goes into making that decision. How much do you estimate your payroll is going to be? What sort of healthcare workers are you going to have? Sometimes the PEOs take on that responsibility and put you on their payroll plan underneath their workers' comp insurance so that you don't have to worry about those things. But there's some good and some bad to that. I'm going to get into that just a little bit later. But when you're looking at PEOs and back offices, it's all about providing you with the support and infrastructure that you need to ultimately function like the business that you want to be. To be fair, let's talk about the pros of a PEO and what they're good for. There's usually two key factors that are really helpful about most of the PEOs that are in the industry. They usually are going to provide you with financing to meet your payroll obligations, which is great because you're going to be carrying healthcare worker salaries, and healthcare worker salaries are above average. And you're going to be carrying that for 30 days or 60 days at a time. So a lot of the PEOs create credit lines or services for you to be able to front and provide that payroll coverage while waiting to be reimbursed. The downside is that they control all your money, right? So they're going to be the ones that give you the money, they're going to be the ones that receive your money, and you're going to have to give up that responsibility. But the positive is that they're going to help you meet your payroll obligations. Another thing that's really beneficial about the PEOs and back offices is they usually have one global company that functions as the master company that is providing all the payroll services to all the companies that they work with. And since they have this master policy that is responsible for all the workers that are working with you, you don't have to carry a workers' compensation policy. They'll give you the workers' comp certificates. Now, again, there is a downside to that. But for people who are just getting started, who are having difficulty getting workers' comp or don't have a lot of money, this is what makes PEOs very attractive. A third thing that I want to add to something that makes PEOs attractive is that they take on the heavy lifting of managing and running your payroll. Sometimes they help and manage your invoicing too. So that leaves you in a position to focus on the bread and butter of the business, which is either sourcing new clients or patients, or sourcing new contracts, and finding the workers that are going to work for your patients or for your facilities. So rather than deal with this kind of financial component, the payroll processing, the reviews of timesheets and that sort of thing, they take that responsibility away from you, but it's going to cost you a fee, of course, and they leave you to focus on the core of the business. This could be a positive, and it also can be a negative. So far, PEOs and outsourced back offices seem like a good fit. In fact, I've partnered with a back office provider by the name of healthcarebackoffices.com to help you in ways that other PEOs simply don't. But before I get into what makes healthcarebackoffices.com special, I need to talk to you about the dark side of PEOs that must be avoided. When I started my company, the internet didn't exist the way that it did. We started in 1996. It was just AOL at the time. There was no information on the internet. It was a really crappy tool compared to what we have available to us today. And we were in a position to only be able to start with $5,000, which is not a lot of money by today's standards. And even by those standards, there were no PEOs that we knew of. We couldn't get any money to fund payroll. We grew very organically in a basic way. So it wasn't even an option for us. But now that I've worked with a bunch of clients and I've really got a good understanding of how the PEOs work and analyze some of the offerings of these PEOs, I have to say that there's a pretty dark side and ugly side to PEOs. Their business is highly dependent on you being dependent on them. So by taking control of your payroll and by putting you under their workers' compensation policies, they have all of your history under their control. And this is a really bad thing, and here's why. Remember those PPP loans that they gave out, the Payroll Protection Program? These were forgivable loans, sometimes into the millions of dollars, and they were given to companies that maintain their own payroll. So if you're an agency and you're working with a PEO and they're the ones who are managing your payroll and cutting checks for you in their name, having your workers under their workers' compensation policy, you're not the employer of record. You're actually subbing out the services to them, and they're their employer of record. So what happens when there's another PPP loan, or you need to prove, or even the ERC tax credits? What happens to your organization when there's some sort of financial stimulus that would benefit you if you maintained your own payroll? That payroll's under another tax ID number, under another organization altogether, and you don't benefit from that. Major issue. Another reason that's a big issue is because whenever you decide to move away from the PEOs that charge a percentage of your payroll and what you're collecting, it's usually between 10 and can be as high as 30%. So if you decide to try to move away from them and start getting your own workers' comp policies and doing your own payroll, you're gonna be kind of rated at the new company rate because you have no workers' comp history at all. Right? You've been functioning under somebody else's company under their workers' comp. And workers' comp is weighted, so is unemployment, based on usage. So if you have a lot of workers' compensation claims, then your premium is going to be higher. And if you have very little workers' compensation claims, your premium is going to be lower. But there's usually a baseline that's somewhere in the middle that they start you at, which is like par for the course. By not maintaining your own workers' comp and your own payroll, you're missing out on tax credits, being eligible for certain loans, and getting preferred or preferential pricing on your workers' comp, especially if you have good history. You forfeit all of that. And then you become dependent on working with the PEOs for life. And to me, that just doesn't seem like the right fit. Another thing that they do is they lock you into these long-term contracts, sometimes 3 years at a time. Again, 3 years of not having your own workers' compensation history, managing your payroll, giving up to 30% sounds like a crappy deal to me. To be fair to them, the reason that their fees are going to be as such is because they're covering your workers' comp in your payroll, right? That's going to be anywhere from like 3 to 7% on average. They're covering your cost of paychecks, mailing your checks, that sort of thing, doing your tax filings. They're also, sometimes when they're more expensive, like in that 30% range, the reason why they're charging you 30% is because they're also assuming all the payroll costs, your taxes, your unemployment taxes, your Medicare contributions, etc. So it's not necessarily that they're charging you 30% as their commission. Their commission is usually in the range of around 5 to 7% above all of the cost. So you have to look at the fine print to see how they're organized. Their markup isn't that expensive, but at the end of the day, you're going to be in bed with them for a duration of time and not building the experience points that will benefit you in the future when you go independent. Now it's time that we talk about what makes our partners unique and stand apart from the others. Since we work with so many startups and they come to us with their ideas on how to go about their payroll management, etc., we've reviewed a lot of the PEO offerings. And I usually recommend our clients to stay away from working with PEOs. But then that leaves them in a position where they're like, well, what am I going to do to float our payroll? And what am I going to do? I'm just one person. I can't manage all these things at the same time while keeping my nursing job, while taking care of my family and my children, et cetera, whatever the scenario is. And what I say to that is, look, you're in a pretty crummy position, because at the end of the day, you don't have the money for payroll. And I really don't recommend the service because it's just going to eat into your margins. And that got me thinking, why not kind of work with a provider and develop a service that kind of is a better fit for the sort of clients that we work with. And that's where healthcare back offices really came about. I started looking at the services that my financial team at On Time provides and decided, let me pull out a section of that team and form this new partnership where we provide back office services to agencies without the handcuffs and commitments, and while still putting you in a position to have a line of credit, while putting you in a position that whenever you want to leave your service, that you've gained the employee-employer point relationships, and you have your own workers' compensation policy. So the way that healthcare back offices works, which is different than everybody else, is that we source your capital, we set you up with your payroll provider, we get you your workers' comp, it all remains in your name, and all we do is manage the actual administration of that so that you're not dependent on us. And whenever you're ready to hire externally, you just take control of your accounts again and everything remains the same. To me, that is so much better than how the PEOs are organized, because like I said, they're trying to sink their teeth in you for life. And what we find is that even if we release the reins to you so that you can manage it internally, if you're managing it with internal resources in the United States, it's going to cost you more than our services, because our back offices are located overseas. So our staff is a whole lot cheaper and we're able to do it at a discount. We even help companies like yours link up with our VA partners. So even if you said, hey, you know what? I'm ready to start hiring my own VAs. Can you transition your back office support to this new resource? We absolutely could do that, because we're helping with getting those VAs. We even help with the training of those VAs. And if you're interested in working with remote workers, overseas staff, you can always reach out to us at Passive Workforce and we can connect you with our preferred provider. I have more than 20 employees working through that organization. It's a huge help, much cheaper than hiring staff in the United States. But when you look at the back office services that we are kind of handling as a subdivision of Passive Workforce in our software company, we've got you completely covered in a better sort of arrangement than any PEO in the market.
If you want to go at it alone without a PEO or a back office, I suggest that you watch this video that provides a vital HR tip that could save you from disaster in the future. Watch this video to learn how to classify your employees properly and drastically reduce your odds of being the victim of a lawsuit.